Good evening, everybody, and welcome to the Boulder Community Health Town Hall on the COVID-19 pandemic. I'm Grant Besser, President of the Boulder Community Health Foundation and Vice President of Public Affairs. Thank you for taking the time this evening to learn more about our ongoing plans around the COVID-19 pandemic. Tonight, joining us, we have over 1,800 people from across our community joining the virtual town hall, which is being held from the Boulder JCC. The strong attendance is representative of how invested our community has been in being part of the solution since the very beginning. On a quick safety note, I wanted to call out that all of our presenters, please wave your hand, are sitting 6 feet apart. In addition, everyone is wearing a mask, but we'll be removing these when we speak to ensure that you understand all that we wish to share with you this evening. On that topic, we have a very informative panel for you this evening. We'll be sharing information on the following topics: the current presence of COVID-19 in our community, our ongoing plan to manage this disease, our timeline for resuming comprehensive health care at Boulder Community Health, and all that we are doing to keep both our patients, families, and staff safe when they visit our facilities. We have an incredible group of panelists to cover these topics. First, we have Dr. Robert Vissers, President and CEO of Boulder Community Health. We have Jackie Attlesey-Pries, Vice President of Operations and our Chief Nursing Officer, Dr. Ben Keidan, Vice President and Chief Medical Officer, and Dr. Amie Meditz, our Infectious Disease Specialist from the Beacon Center for Infectious Diseases. The panel will be followed by a Q&A of questions that you have submitted prior to this evening's event. This will be moderated by Casey Diekman, our Director of Pharmacy at Boulder Community Health. Thank you so much for the questions that you submitted. Thus far, we received over 250 questions, so we've extended our time for the town hall tonight to end at 6:30, so we can cover multiple topics if you can stick around. Before I turn things over to Dr. Vissers and our panel, I want to thank you on behalf of over 2,500 employees hard at work at BCH for all that you have done in support of BCH during this critical period. This outpouring of support has been quick, tangible, and heartfelt. Let me share a few stats with you to bring this point home. Thus far, we've had 31,400 items of personal protective equipment donated. This includes masks, gowns, face shields, disinfectant, and many other items, really helping us to augment our overall PPE supplies. We've had 5,000 hand-sewn masks donated. It's clear that the sewing community truly knows how to mobilize across Colorado. We've had close to $2 million donated to the COVID-19 Response Fund and Feed the Frontlines Boulder Fund. This came from over 2,000 donations from across the community. From Feed the Frontlines Boulder, over 9,000 meals have been delivered to BCH employees, City of Boulder Police and Fire Rescue, Clinica, and Wardenburg Clinic SCU, and we'll be announcing more partners in the coming weeks. In addition, we've had a plethora of in-kind donations from local companies and hundreds of notes of encouragement, including the howling at 8 o'clock each night across the community, hoping that you all participate in that tonight. These are just a small sample of the thousands of gestures that have led to our success treating and caring the community during this time. In celebration of all that you've done to support us, we wanted to share a quick video that we pulled together highlighting many of these moments. Thank you for all that you've done for your community health system.
All of us on the front lines of the COVID-19 pandemic are inspired every day by the overwhelming demonstration of kindness and generosity from the Boulder community. We are so grateful for the outpouring of support. Everything from donating protective equipment for our frontline workers, to hand-sewn masks, delicious meals, financial help to help address employees' critical needs and remove barriers to care, along with hundreds of messages of encouragement. We are stronger because of you. And our community is much safer because of the way the BCH family is working together during this challenging time, providing exceptional care. Their detailed preparation for treating COVID-19 patients, their willingness to take on new roles where extra support is needed, their passion for taking care of their patients and their community. Our community and the BCH family, we are stronger together, now and always.
Thank you indeed. If there was ever a time for us to be grateful, this is certainly it. Prior to my current role, I spent many years as an emergency physician working in very busy inner-city level 1 trauma centers and experienced mass disasters and casualties and industrial accidents, swine flu, MERS, SARS. But you don't need me to tell you that this current pandemic is unprecedented. It's particularly unprecedented in the way that it's impacted every single one of us, not just our health, and but the way we do things every day. For me, it's also unprecedented in the way that this community has responded. It's hard to imagine a community being more supportive and thoughtful, the way that you've become so engaged, and for that we are truly grateful. I've worked at a number of great places during that time, but I can also tell you that I've never been more proud to belong to an organization than I have to belong to Boulder Community Health, and the way that everybody has stepped up and worked hard and what's been accomplished over the last 8 weeks. I don't know if you recall what you were doing 8 weeks ago. I certainly hope I was eating at one of the great restaurants in Boulder, but at that time, I don't think even then, knowing a little bit of what we saw on the horizon, could have anticipated what we have accomplished over the past 8 weeks. And truly, it's been a Herculean effort to do what we have done. During that time, we have prepared. We have acquired, graciously received donations, sterilized, preserved, and created a personal protective equipment to make sure all our employees stayed safe, and so that also all our patients remain safe. And not only just for the past 8 weeks and now, but we have personal protective equipment to support us over the next weeks to months. So we feel very good about that. More importantly, our preparation was to prepare for that potential surge. And we've taken our community hospital and transformed it and its ability to care for COVID as well as all the care that we provide over the last several weeks. We now have the capacity to take our 18-bed ICU and turn it into 70 critical care beds, from 10 ventilators to being able to ventilate 50 patients, and taking the overall capacity of our hospital to more than double should we need it. Thankfully, and because of your efforts, we have not seen the surge that we anticipated, and in fact, if anything, we've seen some decline. But there are times where we were caring for 20 or more COVID patients or potentially positive patients at a time. I'm heartened to report that as of this morning, we only had 3 positive patients in our hospital. Everyone's aware of how devastating this illness can be. and it takes lives. It has taken lives in our community and at our hospital. But I also want to share with you that the vast majority of patients that we've cared for are recovered or recovering at home. When we reflect back on this time, I believe we'll look back and be proud of our outcomes and say that these are the outcomes you would expect from a world-class health facility. We will all experience losses, but we will get through this. And when we succeed, it isn't just because of what we did over the past 8 weeks or what we will do going forward, but because of who we are as a health system and who you are as a community prior to this. This is a health system that before COVID spent every single day thinking about and working on how we can provide care more safely, how we can prevent infections in all of our patients. This is an organization that has not just one infectious disease consultant, which you might expect at an organization even much larger than ours, but a team of 4 experts, one of whom you're going to meet today. And this is just a small reflection of the incredible bench strength and talent and skills that we enjoy at our community hospital, and that I don't think we'll ever take for granted after this. Finally, I don't think we would have been able to be this successful, this nimble, to adapt and make the changes that we had to and provide the compassionate care that we have if we weren't the independent, nonprofit, community-based health system that we are and will be for years to come. It's important for me to share a couple of messages with you or take away a couple of things. One is we are prepared for COVID. We're prepared for it, and we have been, and we're prepared for any future surges as well, and to live in a world where we may be dealing with COVID for quite some time. But we're also prepared to continue to care for your healthcare needs. And if you have been getting healthcare before this or feel like you may need it, you need it now as well. And myself, my providers, and certainly your doctor are becoming increasingly concerned that we're putting off our healthcare needs much to our own detriment. You need to know that at BCH, all our clinics are open. They're open to see you in person. We've done thousands of video calls and phone calls to make sure that we continue to provide your care. If you have any questions about the care that you may or may not need, reach out to your provider. Go to the website. There's tons of information there. If you don't have a doctor, go there and get one. We're ready and willing and able to care for you. Also, we've started our elective surgeries this week, or at least our less urgent and emergent surgeries. Every single person before they get their surgery is being tested for COVID. So far, I think we've tested over 100, and thankfully I can report that none of those have been positive. So that's also very encouraging news. I mentioned at the outset that the way that this affects every single one of us. And I don't think there's any of us in this room, and certainly myself, who are listening to this, that hasn't been fearful. The uncertainty, the lack of control is frightening. And the other thing I want to let you know is we're in a very different place than we were 8 weeks ago. There is a lot more certainty about what we can and are capable of, both in our hospital and as a community. I need to tell you that you do have control, and you've already made a tremendous difference. There are few things as rewarding as perhaps saving a life, curing a disease, removing pain and suffering. It's even more rewarding if you can prevent it from happening in the first place. I truly believe that the leadership and the actions of our state, our county, our city, and most of all, the behavior of our community has done just that. You have saved lives. You have made a difference. And this isn't just a random number, but these are the lives of your neighbors, your parents, your grandparents, and your loved ones. And for that, most of all, I thank you. Are you next, Ben?
I think so. I'm going to follow up with just some of the data that we have about our experience with COVID so far in the last 6 weeks or so at BCH. Often people ask, what is it like? I see pictures of New York and Seattle and Italy, and probably many of you have gotten emails from friends about some hospital in a hotspot, and so people are, want to know what's happening here. So I think Rob alluded to our experience, which has been different than some of those hotspots, fortunately. And I just want to review the data. Before I do, this data is primarily inpatient focused, so the hospital setting. I also want to just acknowledge the work that's gone on across our community of BCH, so our urgent cares, our primary care clinics, our specialty clinics, our emergency department, and the inpatient units. We've been caring for people who have mild symptoms, who have no symptoms or don't have COVID, people that have moderate symptoms but don't need to be hospitalized, and then this is referring to the hospitalized patients that I'm going to show you here. And so it's been a real team effort, and I feel honored and humbled to be a part of the team that's doing this care and planning for the future, whatever that may be. So our experience to date, as of yesterday, this is our total number of inpatients at BCH with COVID. You can see in the black was, as of yesterday, the number of patients we had in the hospital. It's lower today, as Rob said. So we had 4 as of yesterday. We had 29 that were discharged, so went home and presumably recovered, although we don't follow them after discharge for that data. And we've had 7 deaths so far to date. So that's 17.5% of the patients that were admitted. I think it's important to make sure that we all understand that's not a mortality rate for COVID. That's just the mortality rate of our small sample of inpatients, the sickest patients with COVID. Of the 3 deaths, 3 came from home and 4 came from senior living facilities. 3 different ones. Can you go to the next slide, please? This is our average length of stay, 7 days, ranging from 1 to 41. As you can see, some of these patients require long stays, including fairly significant ICU stays. Average number of ventilator days for our 4 patients that have been ventilated is 11. It ranges from 1 to 16. And we've only had 4 patients so far ventilated, which is about 10% of our inpatients. That's a little bit lower than sometimes you see in larger data from other cities, where often you see around 20 or 25% ventilated. We don't know if that's because we have healthier patients or that we are taking a less invasive approach or some combination. Next slide, please. You can see the age range of the patients that we've admitted with COVID, and not surprisingly, there have been no patients under the age of 30, and there's been no deaths under the age of 60, and I think that's 6 patients under the age of 60 total. The rest have been in the 60-plus range. You can see the breakdown on the slides. That also includes our 7 deaths. Next slide. This is just a testament, when you're trying to describe what it's like caring for patients with COVID. I think Dr. Meditz will maybe elaborate a little bit more. But it's different. There's a lot more protocols you have to go to. We're donning and doffing or putting on and taking off our protective equipment. There's fear. I think that's a real fear that we're at risk as healthcare workers. And on the your top left screen, I guess it is, you see these IV poles sitting outside the ICU where we modified the tubing so that the IV poles are usually right next to our patients in the ICU, but now they're outside the ICU rooms so that the nurses can adjust medications without going in and out of the room as often and increasing their risk of exposure and our patients' risk of exposure. It's just an example of the ingenuity that's been happening all across the country in taking care of people in a way that's just different than what we're used to. To my far right, you see they're putting on a PAPR, which is for higher risk procedures like in the emergency department. And then the rest looks like ICU nurses and some ER staff. And I did want to just, recognize all the hard-working frontline staff that are coming to work every day with good spirits and taking care of our patients with COVID or not. Really without question, it's been heartwarming. Next slide. So Rob alluded to this. I just wanted to build on it a little bit. That our foundation is, he talked about our infectious disease docs, but it's even bigger than that. It's our intensive care physicians, hospital medicine, nursing staff, primary care docs, many, many other people. We have a really strong team which allowed us to pivot really quickly and prepare. And I think Jackie's going to talk a little bit about all the planning we've done to make sure that if we get a surge, micro, macro, whatever, we are prepared. But we had the bench strength to go ahead and do that and do it really best in class. I mean, it's been impressive. Specifically, I want to talk about our infection prevention team, which is really led by the infectious disease docs, but also our infection prevention team and our quality department, where we've already in the last year showed major improvements in our healthcare acquired infections, so that they're currently significantly less than you would expect given our patient population. And the reason I'm pointing that out is it's the same principles of infection prevention that we're using to help take care of COVID patients, building on them for this different disease as we're learning. But having this foundation has really helped us, and as Rob had said, if we had to try to hire an infectious disease doc right now, that would be pretty tricky, so don't get any ideas. And we're building on that even more. And one of the things I'm going to talk about in a second is what we might take out of COVID, but I think that all of this work we've done, we're gonna keep track of it in case there's another pandemic or another reason that we have to surge, because this probably will not be the last crisis we have to deal with. So these are just a couple silver linings, I guess I'll call them, from COVID that I think will go on after this crisis is at least stabilized or has resolved. And I want to start on the patient-centered care. That's been a focus of us at BCH for years, and it's really pushed us a little bit to do things like improve our palliative care and advanced care planning, something we've always done well, but really having to forcing us to look at how do we make sure we're asking people what their wishes are and providing the care that they want and desire, and build some processes to improve upon that so that we're addressing it at our outpatient clinics, in the emergency department, in the ICU, or wherever. And that's been a big team of people, including our palliative care docs and chaplains, nursing staff. Hospital at home is a concept that we've built to address a possible surge. We were looking at a few weeks ago we were talking about could there be 500 patients in our hospital? And what would we do in that scenario? And so we looked at all sorts of things, including expanding bed capacity. But another thing was, can we try to get people home quicker or not admit them at all if they're mildly ill or moderately ill through remote monitoring, better technology, home-based pulse oximetry, blood pressure, temperatures, video visits with physicians, in-person visits with nurses or video visits with nurses as needed. And so we've already built that, we've piloted it, and we feel that that's ready to go if we need it to expand our capacity. Our hope is that we can use this in the post-COVID world to keep people at home where they're safe and they're not at risk of hospital-acquired infections and things like that, and we can ensure good outcomes. I think there's going to be more work on that as we move forward. And then telehealth video visits. I just came from my clinic where I did my first televisit and video visit, and it was great. I mean, patients being able to be in the comfort of their home with high-definition video, and there's some real advantages that I think we might use video visits and televisits more in the future outside of COVID. Not probably as much as we're doing it right now, but I think that's going to pivot and continue, and that's something that we've been wanting to do, and this really gave us a push. And then I like the idea of virtual waiting rooms that we've been doing now because we're trying to help with social distancing, not having people wait outside the lab or our imaging. And I think this could be a way where we offer a better convenience for our patients, where you don't have to sit in a waiting room for a period of time waiting, but maybe we can text message you and let you know that, like your restaurant tells you your table is ready. So we're trying to focus on being more patient-centered and learn from this crisis. Collaboration, that's been one of the one of the biggest things that I've witnessed, and that's been across all of our areas here, but many, many other areas at our hospital. All departments really have been involved in a really amazing way. But more so than that, it's been across all the healthcare systems in Colorado have been meeting regularly to discuss how to best take care of our patients, how to best take care of our employees. Protocols, PPE approaches for reuse. We've been sharing this regularly and partnering in really every aspect, and also in planning, like ICU beds at X hospital and Y, and it's really important that we know what the capacity is across the system. And then the county, the city, and statewide, I mean, we've been on calls with the governor's office, with Colorado Hospital Association, and these partnerships aren't going away. We have collectively realized that they are vital to our ability to take care of the Colorado community and the Boulder community, and that is going to continue. And then, I just, thinking of that video that Grant and his team put together and showed just a few minutes ago, it's hard not to get emotional to hear the howling at 8 p.m. and to watch those videos and to feel the real gratitude for our healthcare workers. And hopefully that's something that continues as well.
All right, I'm just going to add my gratitude and thanks for all of the support from the Boulder community. It has been amazing, and I want to tell you our staff have been amazed. They are full of gratitude, and they are so delighted with all of the ways in which we have seen the Boulder community step up and support our frontline staff in particular. So again, thank you so much for all of the meaningful ways. I'm going to do one shout out. I want to really call out the inspiring salute from the city and county of Boulder to our BCH staff from our first responders. It was really moving, and our staff have commented many times on how wonderful that was. We also hope that you felt the return of that gratitude to all of you as we howled back and clapped and tried to show our support for all of you as well. What I also want to say thank you for is for all of you that have taken the personal responsibility to wear your masks, to social distance, to stay at home during this unprecedented time. All the BCH team really appreciates that responsibility to try to prevent, and which you have done, prevented a surge of a great deal of patients coming into our hospital all at one time. This will be very important as we move forward as well, so that we can prevent that micro or macro surge. When I speak about the BCH team, I do speak about our whole team across our inpatient hospital and our ambulatory settings, so our physician clinics. So all of our staff, our nurses, of course, and our physicians, of course, our respiratory therapists during this specific illness that has been plaguing us. But it's also about everybody has stepped up, our other therapists, our environmental services staff, our technicians and assistants across the board, our chaplains, our educators, our pharmacists, our lab and other support areas, including our IT staff, and all of our business units have all stepped up during this unprecedented time to be prepared for whatever comes to BCH. And I want to assure you that our team has got this. We have seen such amazing work by all of our staff, and they have stepped up to learn new skills. They've stepped out of their comfort zones, and they've actually done things very differently, as Ben pointed out in some of the pictures, than what we typically do in our hospital every day and in our ambulatory setting. It has really, truly been amazing to watch our staff really come together and care for this community, even under these circumstances. As was mentioned, we do have a contingency plan or a preparedness plan that is very detailed. So we had the luxury, unlike a lot of the hotspots across the United States, to really take the time to plan. And I will tell you, we have planned every detail. So if we are faced with a surge or a number of patients hitting our hospital at one time, or our ED or our urgent care facilities, We have plans from everything down to labeling every piece of equipment so that we can deploy it to the specific room where it's needed at any time, to that big picture of understanding that we are going to grow our capacity by quite a bit if we need to, and we'll get into more specifics of that with some of the questions that you have asked us. This contingency plan can be activated at any point, and it also, along with the team that I mentioned of our frontline caregivers and our staff, this has all been led, all of this planning has been led by just an excellent group of leaders at BCH. So whether that's our directors, our managers, the executives, some of who are here and some of who are not, who have spent hours in what we call our incident command center, planning these details, and at the same time also supporting our staff through all the changes that we've made in order to be prepared for whatever comes next. So our ambulatory clinics, as Ben mentioned, have really changed everything literally from A to Z. And throughout all of this, our guiding principle has been the safety of our staff and the safety of all of our patients, whether they have COVID or whether they are there for other reasons. Once we prepared this plan, we did actually also do tabletop exercises to prove that the plan would work. And of course, we uncovered some things and we've implemented different things in those plans as we learned from those tabletop exercises. And then as soon as we finished that, we've gone into planning for a transition into what we're calling our new normal. So we have plans, and actually, as was mentioned earlier, we have started this week to get back to doing other things across our full spectrum of care that we provide at BCH. And so we will continue to work on how we have to move forward in the days and months and years ahead to be able to care for COVID patients each and every day, or the next infectious disease or other infectious disease that come our way, as well as taking care of patients that need our services in other areas. So we really do want you to understand and know that we have a very safe facility across the continuum, as Ben mentioned, and it is a safe place to come for the care that you need at this time. I want to tell you that I'm so proud to be a part of this community, to be a part of the BCH team, and to be a part of the group of physician leaders and executives that I work with every day. And I know if you could see what I see every day, you would be as amazed and as proud as I am. I'd like to just reiterate one point and tell you a story. I want to reiterate that if you do need care, it is safe to come to a BCH facility to get that care when you need that. I recently visited our cardiac care unit and visited with a staff who told me two patient stories. Both of them had delayed their care to the cardiac care unit or to our ED because they were afraid to come to a BCH facility, even though they were experiencing clear symptoms of a heart attack. And both of these individuals waited weeks before they came in. And as you know, we're seeing this across the United States, where we have a higher percentage of patients presenting with a much further advanced disease. And that makes it much harder for us to treat you, as well as to prevent any further damage or illness or harm that may come to you with that delay. So again, I want to reiterate that we please seek the care you need. In the circumstances that we are in, it is still very safe to receive care at BCH. And now I'd like to turn it over to Dr. Amie Meditz, our infectious disease extraordinaire.
Thank you. So I'm going to take a little different perspective and talk a little more about the COVID pandemic in general. First thing I'm going to start with is I've took a little bit of a step off from some the questions that we have received from everybody in our community. One of them actually I took from the many times I've been asked this question at cocktail parties. So what is an infectious disease doctor? And the second part of that question that refers to this pandemic is How are we helping BCH as it relates to the pandemic? So the first part is infectious disease doctors are doctors that take care of people who are infected with microscopic organisms. These could be bacteria, viruses, parasites, or fungi. These could infect any part of your body, and infection could be very mild to very severe. Everybody's obviously quite familiar with a novel coronavirus called SARS-CoV-2. This is the virus that causes the disease COVID-19. Our main role in dealing with this pandemic is our team is continuing to see patients with all kinds of infections, including individuals with COVID-19. We also work as a part of a team that's already been referred to today, a team of administrators and physicians to ensure the safety of patients and our staff by helping the hospital develop protocols and treatments based on the most current data that's out there. So the next common question that I'm asked is, what can I do? I'm here in the community, how can I keep safe? So I want to start with recognizing the challenges with the shelter-in-place order. It's in our nature as humans to be social, and we are sincerely grateful to our community for abiding by the physical distancing. It worked. Our healthcare system to date has not been overwhelmed, and this has made a huge difference. I want to explain why physical distancing an entire population was necessary. So first, this was a new infection. Our bodies had never seen it, and we have no immunity. People who are symptomatic as well as asymptomatic or pre-symptomatic can spread this virus. The initial challenges associated with testing and identifying people who were infected also played a role in the problems we initially faced. The final thing is, I'm going to go into a little more depth, is this virus is highly contagious and has had a significant death toll in the United States and worldwide. So although that we have not been overwhelmed at Boulder Community, we're not out of the woods yet. It's important to continue measures of physical separation to limit community spread and unnecessary deaths. If you're a healthy individual and you think, I'm just going to let myself get infected, you should think twice. Anyone could develop severe illness. Yes, people who have multiple medical problems and are older are more at risk. The other thing you should consider is you could potentially infect 3 other people. This has downstream consequences causing severe illness or death in other individuals. These could be your neighbors. These could be your friends. This also has another trickle-down effect that it could, again, come back around and cause our healthcare system to be overwhelmed. Don't get me wrong, I'm advocating caution, not fear. At this point, when you're in public, think of yourself as possibly infected with SARS-CoV-2, even if you feel well. Currently, we want you to stay at home as much as possible, particularly those at highest risk categories. If you need to perform essential activities, like going to your doctor, this would be in that category, or once the Boulder area shelter-in-place expires based on epidemiologic information, we're still recommending certain cautionary measures when you're in public. Continue to maintain the 6-foot distance. We want frequent hand hygiene and avoid touching your face. And we want you to wear a non-medical cloth mask. So I want to go into this non-medical cloth mask a bit more. I want to acknowledge that we all feel awkward, distant, wearing these masks. It feels weird. But wearing a mask is really taking care of yourself, the people you care about, and your community. You should think every time you leave, it's your new accessory. Your cloth mask is going with you. Wear your mask when you're around other people. The function of this cloth mask is to prevent the spread of infection from you. The mask traps the potential viral particles in the droplets that you are breathing, coughing, sneezing. Even if you feel fine, this goes back to that this infection can be spread and you could be infected and you have no symptoms. This is a very popular question in our area, but what do I do when I'm exercising? So I like to exercise. I've given up running, but I still love biking, road biking and mountain biking. And if I'm biking, I bring my mask or my neck gaiter with me when I go out. If I start nearing people, I put on my mask. If I'm on a more populated trail, I wear my mask constantly. It's too much trouble to go back and forth. So that's kind of how I handle it. It's just my new accessory. I also want to touch on surgical masks and N95s. These are designed for healthcare settings and other high-risk environments. All of our BCH employees and staff are wearing surgical masks at work to provide employees and patients optimal protection. So the other topic that's been very popular is testing. Testing has been in the news, and you can probably have seen in the news things are getting scaled up. I want to talk about the different types of testing so that hopefully to provide some more clarity about what the testing does and what's out there. So there's this swab testing. So the swab testing involves putting a swab into the back of your nose where your nose meets your throat. This is where the virus lives. This tests the genetic material of the virus, which is called RNA. And this identifies people who are actively infected. So they're actually currently infected with SARS-CoV-2. This access to this testing, you're going to see significant increases in our community. For people who are sick, they're going to have increased access. This will help us identify people who are infected, isolate those people, and identify people who have had close contact with them. The other thing that's been in the news is a type of testing that's the blood testing. So this could be anything from a finger prick to somebody drawing a tube of blood from your vein. This measures antibodies. So antibodies are a part of your immune system that develops a response to an infection, and in general can provide protection from future infections. This is the basis for vaccines. So we have a test at BCH that identifies these antibodies to SARS-CoV-2, the virus that causes COVID-19. The test that we have at our institution tests people who have had past infection. There's a lot of information about people who have inaccurate tests out there. This is going to be intrinsic. These tests were brought to market quicker due to the allowances of the FDA. And so what we did at BCH is tried to pick the test with the best performance. So what do you use this test for? So this test has been used in the past for epidemiologic purposes. So you study a group like the county of Boulder, you could test that and determine what the frequency of testing would be of positivity, antibody positivity in that area. And that just helps them make decisions about how many people did get infected, particularly in this instance where certain testing methodologies were not available. In fact, here at BCH, we have a project in which we're testing a subset of our employees thanks to a grant from the BCH Foundation. But this test is also of interest because people are just curious by if they were infected. But which is fine. People can order this test, your provider can order this test, but we're not making any decisions about whether somebody can work or if there's certain community activities based on this testing as of yet. We do have some hints from other coronaviruses that antibodies could provide some protection from recurrent infection, but we really don't have any data for this current virus, SARS-CoV-2. So that said, it's critical to maintain the physical distancing, masking, hand hygiene, even if you're known to have had this infection, by either testing methodology, just because we don't know for sure that you're going to have immunity. So people ask me, what is it like to take care of individuals who have COVID-19? So really, when I thought about this question and I closed my eyes, I really thought about the people around me and the staff that I work with. And I think of the amazing ingenuity that I've seen, the collaboration, the general willingness to take care of all of our patients that's come from nursing assistants, providers, respiratory therapy, laboratory, environmental services, food service, and spiritual teams. This has certainly been echoed by all of us, but that's really what is one of the first things that comes to mind. People have asked me whether I am scared to take care of these patients. And really, I feel a sense of respect. I have a process that I go through, which is putting on the protective gear that we have available here at BCH. We have that luxury of having that protective gear that's going to protect us from this infection. And the other point I want to make is that my experience taking care of patients here at BCH is very different than many other areas of the world, of the United States, because we're not overwhelmed here. I'm able to use many of the same processes that I normally go through to take care of patients. I just have to go through putting on my PPE or my personal protective equipment. The other thing that's a bit different is when I do go in to see patients, there's no family members. Just because that's a safety issue, we don't allow visitors. So you're acclimated to having family members when you see a patient, but I would go through the same things, kind of progress plans with that patient. Many times we're getting the family members on FaceTime, so we can kind of have that interactive feeling. So, and then I would leave the room, and we often have an assistant that's helping you talk through removing your personal protective equipment. It's the most important steps for our safety when we take care of these patients. So that's kind of the end of what I had to talk about today, and I appreciate your time.
All right. Time for questions?
All right. Well, thank you to all the presenters for providing all that useful information. And just want to give a shout out to all the community members that submitted hundreds of questions. Obviously, due to time constraints, we won't be getting to each and every one of these. But to start off, testing was definitely a common theme for the questions, and really access for community members around being able to test for COVID-19, and also ability to test to get the antibody test.
So thanks for that question. Basically what you're going to see probably roughly the next week is significant increase in availability of swab testing, which is testing for active infection. So if somebody has symptoms, fever, cough, shortness of breath, sore throat, chills, that there will be testing available in our area, and there'll be increasing availability at Boulder Community as well. The second piece is the antibody test. So if you are without symptoms and feeling well, your provider can order antibody testing through Boulder Community, and you could have phlebotomy and get that blood drawn.
So I guess this is a two-parter here. I guess if a community member does test positive, they have antibodies to the virus. Mm-hmm. Do they have the ability to go and donate for convalescent plasma? So I guess, what is convalescent plasma, and how can the community help in this regard?
Yeah, thanks for that question. So the question was surrounding convalescent plasma. So convalescent plasma is antibodies from somebody that are collected from somebody through a blood donation, like you would go to a blood bank, from somebody who has had infection from SARS-CoV-2 previously. Currently, the protocol asks for that they have a definitive test from the swab test that I mentioned that tests for the genetic material to be a donor for convalescent plasma. All of these donors also have a positive antibody test, but that's not how we identify them. We identify them through the swab test that they had when they had active infection. Did I get to was there another part to that question that I?
No, I think that's good, but I guess to add on to that as well, have we treated anybody with convalescent plasma?
Yeah, thanks. I knew I left something out. So convalescent plasma is one of the potential therapeutics for treating somebody with severe disease from COVID-19. We have treated 2 people in our hospital and with this therapy, and we could have treated more, but the availability of the convalescent plasma has had some challenges, but now we're building up our supply of convalescent plasma in our area, so we'll be able to utilize this more frequently in the future when we have patients that need it. This has been an effort from one of my partners, Dr. Todd Turner.
All right, we'll ask one more medication-related question, then move on to some other topics here. But with that, there has been some misinformation maybe around the potential use of specific medications, hydroxychloroquine, and maybe another a drug called azithromycin. Are we using these medications? Do you have any input that you can provide to the community about these medications?
Yeah. Both of those medicines have been shown to not be helpful to treating this virus, so people do not have better outcomes, and they potentially have significant life-threatening side effects. So we're recommending that these medicines are not utilized. Yeah, thanks.
Okay, so we're moving into this new normal now, and restrictions are loosening across the state, and at this point, our numbers look good overall. We only have 3 positive COVID patients, but are we concerned about this second surge coming to our community?
I mean, since I'm ready, we have significant concern for that, and that's why I was mentioning that we should continue all of these, the same community methods of maintaining distance, trying to stay at home as much as possible, hand hygiene, avoiding touching your face, which I did once. I did catch that. So it is hard. And wearing our cloth masks when we're near other people in public.
I will comment that this is certainly foremost in all our minds, and we expect that our new normal will involve providing a sort of parallel care to patients with COVID. And while we're down to 3 now, we may be up a little bit more this weekend. And collectively across the region, we do have a more data acquisition to give us a little bit more warning if we're starting to see a surge. So I think that's positive. The other difference, when we were talking about flattening the curve and the fear of the surge several weeks ago, this was also based on a lot of uncertainty and unknowns. There's some other things that give me reassurance. One is not only I think we'll see it coming, but we've clearly demonstrated that as a community, we can flatten that curve, that we are capable of that, and hopefully we're able to scale back and respond quickly. Secondly, we have robust plans in place to deal with an increase in volume that weren't present several weeks ago. And not just us, but all the care facilities within the county and the region. So while we're always cautious, and absolutely the best way to prevent it is for us to continue to maintain the recommendations from Boulder County Health and continue all the good hygiene and distancing, et cetera, we are prepared for surges should they occur. We're in probably a lot better place than we were before. And ideally, it will be a lot less than what we anticipate.
So you had mentioned that we've started doing non-urgent surgical cases as well. So how are we balancing that potential surge aspect with now having these non-COVID patients in our hospital as well?
I guess I can start with what I mentioned is that right now we have 3 patients, but that could expand. But we currently, even not utilizing any of our surge capacity and increased bed capacity, we have 180 beds at Boulder Community Health. And so we already have significant capacity. Most of the patients that enter into our hospital, even our surgical patients, are in and out of the hospital in a few days. And one of the other things we've learned is the ability to scale down quickly. In fact, it's almost much harder to scale up than it is to scale down. And so we feel that with our heightened surveillance and that we will have a greater warning, that the increase will be slower, and we have more than the capacity to care for it, and if necessary, scale down and scale up, and do both these things simultaneously and safely. I don't know if there's any other comments from Ben or Jackie, but...
I'll just add, to sort of elaborate on what Rob was saying, is we're keeping very careful eye, and I didn't refer to the statewide data, which is available on CDPHE's website, and it's changing regularly, and so they've updated, I think, in the last 24 hours. So you can see pretty clearly the total hospitalizations across the state. You can see that in the last 5 or 6 days, we went from surge early on, plateau for a while, to coming down over the last 5 days for the state. And so we're continuing to watch that regularly, in addition to talking to our health system partners in our county and region, and looking at their numbers regularly, sharing that data. So we have warning signs if, for example, Good Samaritan, Vista, Longmont United, et cetera, are starting to see surges. We're in communication so that we can share resources if needed and also plan ahead. And so we have also built in contingencies that if we get to a certain number of ICU bed capacity, which at this time we're not close to, where we are using close to our thresholds, then we can scale back our surgical cases, for example. And as Rob said, most of our surgical cases do not stay in the ICU postoperatively, and many don't stay in the hospital at all. Others stay for 24 hours or a couple of days. So we have pretty good warning signs that we're keeping track of carefully so that we can adjust it at any time. In addition, I think Rob mentioned we're testing all of our surgical patients. So far, the 100 or so have all been negative, which is reassuring that our community has low prevalence right now. And all of this work we've done to create these protocols so that we have safe practices for our patients, whether it be screening our visitors with temperature and a questionnaire, whether it be all of our people coming to the facility wearing masks, including all staff, and our PPE, our personal protective equipment, which, it took us a while to work out every different situation for a high-risk OB patient, for a neurosurgical patient, for an ENT patient. But now that we've done that, we feel pretty comfortable that we've minimized the risks.
And Jackie, you were integral in the contingency plan. So I guess just to give the community maybe some insight, as we do have a fixed space in the hospital, say we do have an influx of patients, how do we handle that? What does our ICU look like now, and how does the ICU change if we were to see a surge?
So I can go into a few more specifics around that. So currently our hospital has about 160 beds total, but that includes our behavioral health unit, it includes our special care nursery for our little newborns, and it includes our labor and delivery unit, where we would not expand into in those beds. So we start out right around about 120 beds total. For beds that we would currently use for what I'll call acute care, for those other areas of the hospital, and that does include our mom-baby unit. For our ICU, we currently have 18 beds. We do have a plan that was mentioned, I think Rob mentioned those numbers earlier, where we can get up to about 70 beds. Now that is moving into one of our med-surg units that we currently have. And so that would leave approximately 110 beds that we could use for those patients who don't need ICU if we do expand into that other med-surg unit. So total, we could get up to, for excluding those other areas, we could get up to 180 beds where we could care for patients around the clock. That is moving into some areas that we currently use, for example, for pre-op room. So before you go into surgery, you might be in that room. It's also doubling up our large ICU rooms as well with patients there. That plan, like I said, is very detailed. It has all of the equipment to match. It has the ventilators to go along with those ICU beds or other respiratory support devices. And we feel really good about our ability to handle micro or macro surge.
We did receive a couple questions related to collaborating across the state. So maybe just give some insight on the daily phone calls, whether it be with the governor or chief medical officer or an infectious disease doc.
Yeah, I can start, but I think we've all experienced it. And I would say before this, the healthcare systems have always worked collaboratively if it's in the best interest of the patients. And it's required our collective skills to really to effectively provide what I think is outstanding care to the Front Range in Colorado. But no more I've never seen us come together like we have recently. And it isn't just collaboration between the hospitals and the health system. So initially when we weren't doing testing, UC Health stepped up to do some of our testing. And for the one patient we had to transfer out for a very high, unique level of care, UC Health graciously received and cared for that patient. There are other systems where we've talked about exchanging equipment, shared information about how much we have, and been very transparent about that, and capacity as well. And there's multiple calls. I can't tell you how many calls I'm on a week, but weekly, if not daily, calls between, just last week, all the CEOs of the leading systems, we got together and said, how can we safely bring elective surgery back? And what makes the most sense? And can we do it in a way that is uniform across the Front Range so that everybody's getting the same message and that we're providing the highest level of safety? The governor's office has been incredibly active and informed and thoughtful and soliciting information. The Colorado Hospital Association has worked very closely with the legislators and the state government to make sure that we're allocating resources appropriately and being thoughtful in the care that we provide and making sure there's a balance between our ongoing care and our ability to care for COVID. The examples go on and on. City Council has been seeking the input of not just us, but Boulder County Public Health, which has also been an important partner, along with all of the nonprofits providers in the community. I hope it stays this way. It's been remarkable. It has only made us better providers of care, and I think one of the outcomes of this will be a greater level of collaborative care across our continuum and our community. I think you guys probably have some similar experience. I don't know if there's to add to, but.
The one thing I would add is, and I think, we all feel the same way, that when we have these conversations with our counterparts in other systems or across the state, the first thing that we're all thinking about is how can we take care of our patients safely and most effectively? And then the second thing is how can we take care of our staff and our physicians safely and most effectively? And that's sort of like how we guide it, and then the rest of it, kind of comes from there. And other than that, I think Rob really touched on the points that I would get, that there's been just really extreme collaboration in a really positive way.
And I would just add, we've also learned a lot from other parts of the United States as well. So we have looked to some of the areas that had the hot spots prior to this really going across the United States, and really have learned a lot. And those individuals have been very generous with their time on various different webinars through some of the organizations that we belong to, or our group purchasing organization, for example. And so we have really tried to incorporate that experience ongoing into our plans and into the care of our patients.
So there has been unprecedented collaboration among infectious disease physicians. Basically, the collaboration is at such a level as if I ask if I need something, I get it. There's no competitive concern. There's complete openness. And if you want this protocol, this research project, that research project, completely open. This is not, just as Jackie mentioned, this is not only for within the state of Colorado in collaboration with other institutions in other states. It's been, amazing, and hopefully that continues. I think that has helped us not have to recreate the wheel here. We were able to use things that were already in place in other places and get ahead of the game to get us prepared faster.
So, Dr. Keidan, you just mentioned that we need to ensure we're taking care of and protecting our staff. So I think this is a good segue into personal protective equipment. Obviously, this is a hot topic in the media, really the lack of personal protective equipment. So can you speak to our current state of PPE?
Generally speaking, and I think we've all sort of alluded to it, I think two things can be true. One is we have enough protective equipment at this time and for the near to long term, and we're really concerned and cautious and making sure we're using UV light disinfectant for some of our PPE, and that we are responsible stewards of these limited resources, and also that we're working really hard purchasing PPE from really all over, and so we have a few areas where we're obviously keeping a careful eye on, but at this time we don't have any critical shortages.
I would agree, and we do track this on an ongoing basis. I'll give a shout out to Teresa Cole, who is one of our directors at BCH, who is also an IT director, but she's also over our materials management, and she has done an outstanding job of helping us understand our burn rate, is what we call it, how much we're using and how far out our current equipment for personal protection would take us. And we are very comfortable right now, and again, as Ben said, doesn't mean that we're not cautiously and being very careful with our usage of it. But we do feel very good about where we're at right now, and that we could match personal protective equipment with a surge in COVID-19 if it would hit Boulder Community Health.
I'm glad you brought up Teresa, because she's a great example of when we talk about the heroes of this and the heroes that work at BCH. I think we often do think of, and appropriately, the frontline staff, but it really is everybody. And Teresa's an example of, I just this morning heard nurses say, or maybe it was yesterday, if there's an MVP of this, it's Teresa, and she's our materials manager, but her ability to acquire this PPE kept so many patients and personnel and nurses safe, and that's recognized and it's appreciated. And every single person has done their part to make a difference, so it's been really remarkable. The other thing I would sadly point out is the other area that really kept us going for a bit was donations from the community, and that was tremendously significant. So far, we have not received any PPE support from the state or federal government.
Next question's related to signs and symptoms of being COVID positive. So I know when this originally came out, it was really talking about shortness of breath, dry cough, and maybe a fever. Now we're seeing in some younger adult populations that strokes may be occurring. There may be some coagulation disorders, blood clots happening. So can you maybe speak to what's being seen?
Yes, we haven't had any of those sorts of presentations at our hospital, but they have been seen in our area, down in the Denver area. These are presentations that are coming about that we think have to do with the way that the virus binds to our cells and infects our cells. Several steps down the line leads to this hypercoagulable state. So this is something from a clinical standpoint that we have to be thinking about, because people could have these presentations that may be more like strokes or severe headaches that are, intractable, that we need to be thinking about that they may be having blood clots in their brain. There's also been some clotting phenomenons in the lungs as well. This is a little unclear whether it's due to just the severe reaction that the lungs are having to the infection or any infection, which is called ARDS, or this virus specifically. So that's kind of being sorted out, but this is an area in which certain institutions are looking more into as far as therapeutics. I'm looking at whether blood thinners might be helping these people, and these studies are ongoing at other institutions. But we haven't seen that presentation here, but it's definitely something that we're on the lookout for.
So what should a community member do if they start experiencing some symptoms of COVID? Is there a phone number or website, or what direction should they go?
Yeah, I would say the first steps would be to call their primary care doctor. That would be the first step, because our hopes are here in the short term that they would be able to have a video visit with their primary care and be sent to a location in which we can test people for COVID-19 or SARS-CoV-2. Just to quickly review, the main symptoms are shortness of breath, cough, fever. You can have a sore throat, achiness. Two very unique symptoms to this disease are the loss of smell and the loss of taste. So those are additional symptoms that are somewhat less common to other viral infections.
And if you don't have a primary care physician, we do have a COVID hotline. I think I wrote it down for you, Casey. It's 303-415
8180.
8180.
So to repeat that.
And so that's an option for people who don't have a primary care physician or have specific questions related to that. We also, on our website, we have COVID link, which has that information as well as lots of other good and useful information. And so those are all good resources.
At the end of the talk, or I don't know, maybe even now, we're going to put up some resources on the slide behind us as well for people to write down. And the other thing I would just add to that is I would behave as you should anytime you clearly have some infection. Protect everyone else around you. And so it's not just COVID-19. You could have, in fact, we're seeing as much, at least at the onset of this, we saw more people with influenza with the same symptoms than had the COVID virus. However, it's the principles still apply. Hand washing, keeping your distance, and protecting everybody else around you.
And there's one point I'd just elaborate on what Rob was saying, which is even in our inpatients, which are the highest risk, our testing, we're getting approximately 20% or so are coming back positive, which means 80% of the people that are suspected to have COVID who are being admitted still are having some other cause of their symptoms, which goes back to that not all things are COVID, and there's lots of other medical problems, including infections, viruses, flu, other things. So it's just important to have an open mind to all the possibilities and get an assessment.
Next question is related to contact tracing. Are we doing anything with the community to determine COVID positive patients and community members?
So the health department is responsible for contact tracing. My understanding is they are trying to improve their abilities to do contact tracing as they were significantly understaffed to accomplish this going into this pandemic. But BCH, we as an institution are not responsible for contact investigation. That is done through the health department.
All right, next one's kind of a two-part question. So what protections are currently in place for people who need care not related to COVID when they're coming to BCH? I would say that includes taking care of our pregnant mothers and families coming to deliver babies? And then follow-up to that is, how has our visitation policy changed with this?
Sorry, I have the teacher sitting next to me, so I have to keep doing my hand hygiene. So the first one, I will just say generically, including our moms and babies, or our moms and parents that come in to deliver a baby, we have all kinds of safety precautions in place, not only for them, but for our staff as well. And so we are monitoring for symptoms of the ones that Dr. Meditz just mentioned for all of our patients that come in, and anybody else that might need to accompany them. And that is really important, whether you're being admitted to the inpatient side, whether you're coming into an ambulatory clinic, whether you're getting an outpatient lab or an outpatient imaging exam done. And so we are monitoring I'll say at the door, that's not literally all the time, but right at the entrance to make sure. And we are asking everybody to come with masks, otherwise we will provide one if you don't already have one for you. So that's just a precaution to assume that even if you don't have symptoms, that you potentially could be shedding the virus. And so we make that assumption as we care for all of our patients. Unfortunately, and I know Dr. Meditz mentioned this as well, one of the really tough parts of this pandemic has been that limited contact, and it also has affected our ability to allow visitors into our facilities. So we are, have a fairly strict, based on guidelines that have been directed to us through the CDC and or our own state level of our state level public health orders. So unfortunately, that means that we do allow for what we call the beginning of life. So that is a parent can have two people with them, one being a professional doula if that is the case, and then their significant other for deliveries at BCH. And then at the end of life, we do allow visits so that loved ones can be with someone who may be on a few hours of life or days left. Unfortunately, that is the limit that we are able to do just to decrease everybody's exposure, including the patients themselves, because they are also in our hospital, obviously, for things other than COVID, as well as for our staff, so that we can continue to try to decrease the spread of this disease in our community. So it is actually, I know it's been really tough for everybody, most especially our patients and their loved ones. It's also been a challenge for our nursing staff to not feel very compelled to try to make exceptions. But as Amie mentioned, we do a lot with trying to connect the family members to their loved one who's in the hospital under any technical, I think even Ben witnessed some of a family member of one of our patients actually standing in the ramp outside the patient's window so that they could wave and then text back and forth as all of the family was smiling and waving at them. So we do our very best. It actually was one of those things where I had to say that I couldn't be on the group that had to make that decision, because it is heartbreaking at times to know that we are not allowing visitors in.
Is there also a question there about OB patients or patients coming in for delivery, or you already addressed that?
I think I did. Did I do one?
Yeah.
The
Okay.
testing.
Oh, testing. So Amie is reminding me that we are also, for laboring moms, we are doing a test that we can get back fairly quickly. It's an in-house test to, as they're going into labor or when they're in labor, to make sure that they are not shedding the virus or have the virus in that nasal type swab test that Amie did talk about. So that assures us that the mom is safe from not only herself and the staff, but also for her baby who is going to be born.
All right, well, I've got time for one more question. I guess we'll go on to more of a social question. I think everybody at this point is really wanting to see their friends and family, be closer to everybody, and obviously we're not at a point where we can start hugging each other again, but what are your recommendations about having friends over and being able to sit outside, aside 6 feet apart from each other? And what are your recommendations about being with family members that you don't live with?
So thanks for that question. I get asked this very frequently. So I'll just address friends coming over for the 6-foot apart cocktail party. So I feel people should bring their cloth masks with them, but I think that chatting and being 6 feet apart on the outside is acceptable. I still would warn, make sure that you can drive after you go over to your friend's house
Good job,
to
Amie.
have the cocktails, and just practice good hand hygiene. I think that that's perfectly safe to do that. Second, the family member thing I've been asked again also many times. I think if you're able to maintain physical distancing, you wear your mask when you see the person, you use great hand hygiene, I think that is safe to do. Both parties could wear a mask, even your family members. People ask me a lot specifically about their parents who may be in a high-risk group. And if my parents lived in town, I would probably see them outdoors, try to be 6 feet apart, wear my mask. I wouldn't come into physical contact with them, but I would visit them at a distance if I felt well.
So is there a separate rule for mother-in-laws, or is that?
I could make up a separate rule for mother-in-laws here if people would like.
I hope your mother-in-law isn't watching.
Mother-in-law is on right now. I did not ask him to say that.
Hey, is that, we're going to wrap up? All right. I think we were going to put make a slide that has some information. Great. Okay, so we started with a thank you for all that you've done, and I think that's certainly how we should close, but I know that many of you continue to ask the question what you can do. And here are a list of resources, and please stay abreast, and we try and update it daily, information on our website. I think the other important thing is take care of your community and continue to adhere to the guidelines that are being put out by the county as well as the state, and also common sense. And finally, take care of yourself. Take care of yourself and your loved ones, and make sure you are getting the care that you do need outside of being socially responsible around COVID care. Finally, I just want to close with a heartfelt thank you for all that you have done. We truly have gotten through this far mainly because of your behavior and your actions and your responsibility. And you have saved lives, you have made a difference, and we are forever grateful. Also, the heartfelt support and care and compassion and words that you have shared with our frontline staff, our entire healthcare community, has made a huge difference. And every word has been heard, and we appreciate your love and support. So thank you very much. And we will get through this. We'll get through this together. And I believe on the other side of this, we will be not only stronger together, but healthier and a better community for it. So thank you.